hard for us to feel well rested. As adults, the National Sleep Foundation says we are supposed to get between 7 and 9 hours a night of sleep in general, but less than 2/3 of us actually get that much. And about 30% of us say we actually have symptoms of insomnia. Dr. Christina Captain is a doctor of acupuncture and Eastern Asian medicine. She is here to explain how the Sarasota Center for Acupuncture and Nutrition can help. All right, I feel like I can't sleep this morning because I'm not speaking so clearly. Aside from brain fog, what can happen when we don't get enough sleep?
Gosh, so many things. I have to tell you, we're more at risk for obesity. So if you're trying to lose weight and you have insomnia, the very first place to start, or one of the first places, is to get some sleep. And how can you do that? There's so many different ways to do that. So obesity, we're more at risk for diabetes, especially diabetes type 2. We're at risk for cardiovascular issues, metabolic disease, and even can put us a little bit more at risk for some types of cancers. So we really want to get that sleep, and it's very, very important that we do.
I think that's such important messaging because I remember when people used to brag about, I only need to sleep 4 hours a night and I can go. And I mean, maybe you can, but we're learning that that just isn't good for us as an overall system.
It just isn't.
So getting to sleep or forcing yourself to stop and sleep seems to be one of the harder things to do.
Right, and even when we try to sleep, sometimes we just can't fall asleep. We have that overthinking brain, that just analytical, logical brain that just won't stop. So we have repetitive thinking. We're just sitting there ruminating the whole night. We get up, we get down, we get up, we get down, we just can't fall asleep. So many people will turn to medications, and that is sometimes okay. In an emergency, to utilize a medication is very popular, but it's not something we should do for long term because medicated or pharmacologically induced sleep is not equivalent to a natural sleep.
And that's important to learn. I know that's something that you taught me. I've admittedly always taken a something PM to help me sleep, but if that sleep is different than true sleep, then what we want to achieve is that true sleep.
Exactly.
So what is it about acupuncture that helps teach our body to sleep?
So one of the things is acupuncture induces the deactivation of that analytical, logical, overthinking brain.
Okay.
Ha!
Right.
Say that 5 times fast.
So
right
it
there.
sort of soothes the beast that keeps on spinning.
So acupuncture can basically shut that down. 2 of the basic hormones that have to reduce for sleep, one is cortisol, which is made by the adrenal glands, which sit right on top of our kidneys, and then melatonin, which is actually a hormone. Right? People say, oh, I'll just take some melatonin and I'll go to sleep. But if you take too much melatonin, you can get into a hypermelatonin situation, and that's never good either. You can have all kinds of symptoms that come from that. So what we want to do is use acupuncture to help to balance both cortisol output and the decrease that should happen at nighttime before we go to bed, and melatonin balancing, which should rise just like cortisol when the sunlight comes out and decrease at nighttime when it's dark. That's why sleep hygiene is so important. Because our melatonin cycle is stimulated by light and dark, if we're constantly watching television, which is producing light, or we're on a screen right before bed, that melatonin is never going to decrease enough.
That's why we put those phones down and maybe deep breathe or just relax or something like that. So I actually was able to do acupuncture with you, and I was amazed. 2 things. I will be the first to tell you, does not hurt one tiny little bit. You would never know that a needle is actually involved. But number 2, a calming sort of all of a sudden settled into me, and it was very interesting because it was a physical sensation.
Right, so those are the brain chemicals, those neurotransmitters, serotonin, dopamine, and enkephalins and endorphins that help us have that sensation of people go, they put their feet in the ocean and it's cooler water and you're like, or a pool, or you have a drink and you feel that way. This is about changing the brain, and so acupuncture is extremely effective at that. And that's why the military uses it for stress and anxiety and insomnia on the battlefield even.
I feel like I hear about insomnia and, girlfriends that talk about trouble sleeping on a daily basis. It's just something that all of us are talking about. So the good news is there are things you can do, and there are ways to avoid the medications. Do you feel that over time use of any sleep medications is more of a detriment than a help?
Oh, for sure. Yeah, because you're just not getting into the natural cycle, so you have less of an opportunity to allow the body to do that. So we really, really, really want that opportunity to help balance out those cycles, cortisol, melatonin, and even hormones, regular hormones for women like progesterone, estrogen. Those also impact sleep quite a bit.
They certainly do at certain ages, as we're all learning. So medicated sleep is not true sleep. That's the takeaway from today. And that you could definitely get some help with sleep by contacting the Sarasota Center for Acupuncture and Nutrition. You'll find Dr. Captain online at scansrq.com.